Vitamin D has been receiving a lot of media attention as a major health determinant. Today's Right Parenting Tips video will discuss, vitamin D, is it really that important? What is vitamin D? Vitamin D is an essential micronutrient and an important hormone. Vitamin D2 or ergocalciferol and vitamin D3 or cholecalciferol are its two major forms. How do we get vitamin D? On adequate sunlight exposure, the body can produce vitamin D. The ultraviolet B rays in sunlight react with a chemical in skin to produce vitamin D3. The rate of production depends upon timing and duration of sunlight exposure, and other factors such as skin color, clothing, season and location. Ultraviolet B rays are maximum in sunlight between 10 a.m. to 3 p.m. Non-vegetarian dietary sources of vitamin D include egg yolk, liver and other organ meats, fatty fish like sardines, mackerels and salmon, and fish oil such as shark liver oil and cod liver oil. Vegetarian dietary sources of vitamin D include some types of mushrooms and fortified foods like milk, formula, fruit juices and cereals. Overall, vegetarian diet and even breast milk are not rich sources of vitamin D. So, what role does vitamin D play in health and disease? Vitamin D helps in the absorption of calcium and phosphorus, which are important for strong bones and growth. Vitamin D deficiency in children leads to rickets, which is characterized by soft weak bones prone for fractures and deformities. In extreme cases, it can even lead to growth retardation. Adult vitamin D deficiency causes soft weak bones through a condition called osteomalacia. Vitamin D keeps the immune system healthy. It is important for cellular immunity. It helps prevent common viral and bacterial infections such as upper respiratory infections, flu, pneumonia and ear infections. It has a preventive role against autoimmune diseases like rheumatoid arthritis, diabetes mellitus, Crohn's disease and multiple sclerosis. It also has a preventive role against allergic disorders like eczema and asthma. Vitamin D has anti-cancer activity and protects against cancers of pancreas, colon, breast and ovaries, and Hodgkin and non-Hodgkin lymphomas. It also protects against pain and muscular pain, fibromyalgia, chronic pain syndromes, migraine and pain and sickle cell disease. Vitamin D is important for mental health and plays a role in early brain development, learning, memory, motor control, social behavior and attention. It protects against autism, schizophrenia and depression. It guards maternal and fetal health by playing a preventive role against preeclampsia, gestational diabetes, prematurity and small for gestational age births. It also helps cardiovascular health by offering a protective role against coronary disease, hypertension and stroke. Now, let's talk about vitamin D deficiency. Nearly 25 to 50% of general population is found to be deficient in vitamin D. So, what are the causes of vitamin D deficiency? Lack of adequate sun exposure is an important cause of vitamin D deficiency. It can happen because of cloudy, polluted weather, geographical location, predominantly indoor stay, covered clothing, dark skin tone or sunblock application. Some other important causes for vitamin D deficiency can be inadequate or faulty diet, malabsorption disorders and chronic liver or kidney disease. Certain medications such as anticonvulsants, steroids, antifungal medicines or anti-HIV medicines also can lead to such deficiency. How do we diagnose vitamin D deficiency? In infants and adolescents, the low calcium level can sometimes lead to convulsions as the initial symptom. In adults, the starting symptoms can be nonspecific such as tiredness, muscle and bone pains, muscle cramps and mood changes. As the deficiency worsens, bone conditions such as rickets in children and osteomalacia in adults are seen. There also can be various other systemic problems. 25-hydroxyvitamin D3 level is the best laboratory measure to diagnose vitamin D deficiency. Although lab standards may vary, but in general, less than 20 nanograms per milliliter blood level of 25-hydroxyvitamin D3 is considered as vitamin D deficiency. The levels can tell whether vitamin D is deficient, insufficient, sufficient, ideal, upper normal or toxic. So how do we prevent and treat vitamin D deficiency? This is done through vitamin D supplements. For prevention, usually vitamin D supplements are given as 400 international units every day, and for treatment in adults, 2,000 to 5,000 international units per day, or 50,000 international units every week for 2 to 3 months. The doses may vary according to different age groups and different advisory bodies. To summarize, vitamin D is a fat-soluble vitamin and hormone playing important roles in multiple body systems. It is essential for bone health and growth. It aids immunity and prevents autoimmune and allergic disorders. It protects from cancers and pain. It promotes positive mental health, protects maternal and fetal health, and prevents cardiovascular health. Vitamin D deficiency is very common. It can lead to bone problems such as rickets and osteomalacia, and also cause other systemic problems. Vitamin D deficiency is prevented and treated through supplements.